Welcome back to Midday Kentucky. Quitting smoking can be one of the hardest challenges a person can face. Here in Kentucky, 26% of the population are smokers. With information on how you can get off the cigarettes, we have Angela Brumley Shelton from the Lexington Fayette County Health Department. Thank you for joining us, Angela.
You bet.
And you know, with the new year and everything, the New Year resolutions, I'm sure there's a lot of people out there that do want to quit smoking. So what is the single most important thing that a person can do in order to try to stop smoking?
The single most important thing, after many, many years of doing this and lots and lots of data we know that they can do, is don't try to do it alone.
Right.
Lots and lots of numbers, but if they try to do it alone without help, the cold turkey that most people know, you have about a 4 or 5% chance of succeeding.
Right.
But if you go get help, which means, and evidence-based help, which means a proven program, that you have anywhere between a 25 to 50% chance of succeeding. So that's a huge number.
Yeah,
so
it is.
Go get help.
Okay, and what kind of resources can people find? Where can they go to get help?
Well, in Kentucky, you can basically call your local health department. It doesn't matter what county you're in. You can call your local health department. In Kentucky, we have a quit line. It's Quit Now Kentucky. You just dial 1-800-QUIT-NOW. And they have telephone counseling, they have online counseling, we even have a text program, and also they can hook you up with your local health department. So like in Fayette County, we offer freedom from smoking classes, which is a group class. That's a program that was created many years ago by American Lung Association. So we offer those at workplaces and also in the community. So we will be offering those starting in late February.
Do you have those at the health department as well?
We actually hold them in different places throughout town, so that they're easy access for people all throughout Fayette County.
Why do you think it is so hard to stop smoking? Because both of my parents smoked growing up. My father never did quit until he literally had a heart attack and complications from that and was forced to quit. My mother did actually quit, and she did it cold turkey, and I was shocked, but it was because she had found out she had a high risk of going blind. And so once she heard that, cigarettes went down and she just quit cold turkey. But I know that's rare. Why do you think it's so hard for people to quit?
Well, if you're not a smoker, it's really hard to understand. And a lot of people say, you know, it's just a habit. Why can't you break a habit? It's not a habit, it's an addiction. And I think a lot of people don't understand, and those of us who work in the field and have done this, you know, I've been in it for over 20 years, that nicotine is the world's most addictive substance. And this is kind of my mantra, and I say it all the time when I'm working with somebody or a group. I have a better chance of helping someone in the relationship with heroin than I do of ending the relationship with nicotine. Wow. That's profound.
That really is. And because it's probably legal, that makes it much harder to give up.
It's very complicated.
Wow. So what do you have here today? I see some of the resources that you actually brought in that are available over the counter.
Because a lot of people, when they come to our program, they say, oh, well, what about those patches? And that's the most and these are examples of nicotine replacement therapy. And a lot of times we'll say NRT, and that stands for nicotine replacement therapy. Most people know them as patches, but we have nicotine patches, lozenges, and gum. These are over the counter, and we recommend these, strongly recommend these at the health department, and we use them in our program. And so if someone comes to our program and they don't have resources through their insurance or through Medicaid to buy these, we will make sure we have them low cost available. And so we have really exciting legislation in Kentucky that started in July that it was Senate Bill 89. The private insurance actually has to cover these products.
Fantastic.
Along with some Chantix and some other drugs that we know that work. They double your chance of succeeding.
Wow.
So, and then we can help you use these correctly, because a lot of people come to our classes and they say, oh, I used those 10 times before and they didn't work. But, and we always say, well, yes, but you didn't use them with us helping. So these are very, very important. And we can help people get them in our classes.
That is wonderful. Thank you so much for being here, Angela. And we have your information up on the screen for the Lexington Health Department. If you are looking to quit smoking, then please give them a call and get on the right path to getting off the cigarettes. After the break, it's time to chat about the 2018 the Golden Globe Awards. Plus, find out which films pulled in Star Wars: The Last Jedi from the top spot. It's all coming up on What's Poppin' on Midday Kentucky.